Hi, I'm Dr. CJ Skok. I'm a family medicine physician with Community Physician Network since 2022. I knew very early on that I wanted to be a physician. I would say I first realized maybe early on in high school that it seemed like the right field for me. And the reason for that was a combination of liking science and liking helping people like a lot of physicians, but it just seemed to be a natural career path based upon those interests. I really like being a generalist and seeing a wide variety of medical pathology day in, day out, but I also like the opportunity to work with patients over the long term and develop long-term relationships with families across the whole age range. So seeing everything from infants to older folks. So really seeing the wide variety of medical pathology, but also seeing a wide variety of patients also really interested me. So I think the first thing that I try to focus on is really building a partnership with a patient, and that being grounded in like autonomy and respect. So providing with the most up-to-date guidance I can provide each patient based upon the existing medical literature and data that's out there to provide informed decisions, but also respecting each individual's personal preferences for choices. So I really see it as a partnership of respect and autonomy, but providing the best information that I can, but allowing each individual patient to make their own individual healthcare decisions too, of course. Well, at the end of the day, I think every person knows their individual body the best, and also knows their own personal health histories, family histories the best, which I always ask about those things too. But I think it's important that since they do know their own health best and day out are managing their health conditions and various things like that, that having that personal preference is really important. And I think it's also healthy for a normal physician relationship with a patient in order to have that conversation and that space for that autonomy for each individual to make their own decisions. I really like, all the bread and butter of primary care. So I really do enjoy hypertension management, high blood pressure management, diabetes management. I also split my time in between the hospital and the outpatient care settings, where I work both at Community East Hospital and the outpatient setting. So I do enjoy the variety of both. But at the end of the day, I really just enjoy that chronic disease management and working with folks to achieve the best they can for their health. So what really motivates me is, helping each individual patient meet their health goals and the best they can for their health. And that's really focusing on, a good quality of life, helping prevent future conditions. And I get really excited about helping prevent those things and finding small opportunities for each individual patient of how to avoid future pathology, future medical conditions, and really helping promote their own health in the long term. At the end of the day, I just want every patient to know that I'm there to provide them with the best guidance I can, to be comprehensive as possible based upon the medical literature, to provide a partnership with them over the long term to achieve the best that they can for their health. So outside of work, I like to do a lot of different things in terms of physical fitness. I really enjoy the outdoors. My wife and I love to go camping, love to do hiking, but we also love traveling too and try to take trips whenever we can. I'm Dr. CJ Skok. I'm a family medicine physician with Community Physician Network since 2022.